MedSLP counseling techniques, how to communicate with patients. Were you taught counseling skills in grad school or how to actually communicate effectively with your patients? I know I learned the basics of this in grad school, but I really wasn't able to integrate what I learned until I actually started treating patients. Let's dive into the best ways to effectively communicate with your patients to get the buy-in and trust that's needed for an effective course of treatment. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Counsel every day. Get in the habit of asking your patient how they are feeling every single day. Ask them what is new and good at the start of each session. This builds trust and can help motivate them to keep stacking their wins. If they're having a particularly negative day or don't have much to say, that really helps you to read the situation of what you might expect. It might not be the best day, or you might want to alter your course of treatment to really meet their needs where they are. This is something I've always done with my patients. I'm not sure where I learned it or why, but I figure they're not coming to see me on one of their happiest days. But I do believe in the power of positive thoughts, so I figured we might as well start off with something that's going right. I remember one gentleman that had a pretty horrific and complicated, extensive medical history, and he said to me, "You know, you're the only person that actually asks how I'm doing. I'm not doing too good, to be honest, but I feel a lot better knowing that you actually have a few seconds to sit down and ask me how I'm doing." I know we're all so pressed for time and we all have productivity requirements, but stopping to ask our patients how they are doing and what's new and good should be first and foremost and paramount in our care. By doing this also, you sometimes find out some information that you might have missed through other forms of communication. I can't remember the amount of times I've had patients say, "Oh, I'm doing great. I'm scheduled for my swallow study tomorrow." And I'm like, "Oh, that's wonderful news. It's news to me." So you really never truly know until you ask. There's so many providers that these patients are seeing, and they may not think to tell you unless you ask them. A systematic review of the predictive relationship between patients' recovery expectations and their health outcomes was published in the Canadian Medical Association Journal. And 15 of the 16 articles reviewed showed that positive expectations were associated with better health outcomes. The strength of the relationship depended on the clinical conditions and the measures used. Everyone knows the power of positive thinking, and there is actual evidence that it can have physical improvements too. But of course, this is nuanced. We can't just say that we can just positively think a terminal illness away, but rather positive thinking might help with the outcomes of an actual surgery coming up or treatment coming up, leading to no complications and a favorable outcome. Ask the patient how they communicate best. We are specialists in communication disorders, yet sometimes we don't always communicate the best. Does your patient want to meet face-to-face, over the phone? Do they prefer written communication? Are they able to use these online portals to get their information? I know for my son, he sees so many different providers across so many different medical systems, and there's so many different portals that we're supposed to have access to. And so I proactively try to tell our providers or our therapists, please do not try to communicate with me through those portals because I will not get the information. If that's how you have to do it because you're required to do it by your company or your facility, that's fine, but please do me the favor of calling and letting me know. There's nothing worse than getting bad information through an online portal. I really would love to hear it from the provider or the therapist so that we can talk about it. So we can talk about our options. We can talk about, what course of treatment do we take? What course of action do we take from here? So please consider this, especially if your patients are medically fragile or they're older. Some of these portals are just so challenging. So please, let's try to reduce the barrier to entry for our patients to getting access to us. So as I said, I like to meet face-to-face or have a conversation, but written down is actually so much easier once I've had time to really process my emotions. Getting bad medical news can completely cause brain fog, and you might miss 90% of what came after that initial shock. So do your patients and family members a favor, write down what was discussed, as well as the options. Their decisions might change after they've had time to process and discuss with their families and other trusted professionals. But on the flip side of that, a lot of the bigger medical centers have these big portals that our patients have to get the answers to. So sometimes presenting both options can be really best for our patients to process this really complicated information. So don't make things more difficult for them. Try to reduce the barrier to entry. If they can't access that, don't put the information there. Call and see what works best for them and what you're able to do within HIPAA guidelines. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that subscribe button and turn on the notification bell. I'd also love to further this conversation, so be sure to leave your comments below and I'll reply. So you don't have to go at it alone. There are other professionals such as social workers and palliative care doctors that are happy to accompany you to some of these tougher conversations. When I was a younger clinician and very unsure of myself, I didn't have a lot of confidence in my skills. There was a wonderful social worker at the facility I was working at that really helped me navigate some of these tougher conversations with my patients and their families. I learned so much from her on how to approach them and really truly be there to listen and validate their feelings and emotions. I'm not saying you need to show up with an army of people every time you have to have a tough conversation, but having a buddy that has experience in this area can really help you to hone in your skills. To learn more about navigating these tough conversations, come join the MedSLP Collective over at medicalpcollective.com/enroll, where we have a robust and vibrant community and mentors to help you out. The link is in the description below.